Medicare is Australia's universal healthcare system. It helps with the cost of seeing a doctor, getting medicines, and accessing mental health care. Medicare is a national scheme providing Australians and some overseas visitors with free or subsidized healthcare, and Australians help cover its costs through Medicare levy. On my previous video, I talked about what it was like moving from New Zealand to Australia, and on this video, we'll talk about the Australian healthcare system, focusing on Medicare, what is covered, who are eligible to enroll, how to enroll. Moving to Australia? Well, you gotta plan it with Veronica. First thing to know, like in New Zealand, if you want to see a doctor for a consultation, you have to go to a GP practice. For example, you've been feeling more tired than usual, lightheaded, unable to sleep at night, and experiences palpitation. You can then book for an appointment with the GP, family doctor, and he can take your medical history, complete an assessment, and request for a diagnostic test as required. Now, do know that you have two options: either go to a privately billing practice or go to a bulk billing practice. For your reference, privately billing clinics will charge you fees for the consultation and you have to pay for it outright. However, depending on the amount, you can either claim the full amount or a portion of the amount through a Medicare rebate. On the other hand, bulk billing practices will not charge you for the consultation as long as you are covered under Medicare. X-rays and some tests may be covered by Medicare, but not all. So, once you come in for your consultation, you just have to show your card and then the bulk billing practice will apply for the rebate on your behalf. By the way, for just meeting, kia ora, my name is Binibining Veronica. Welcome to the Little Cup from New Zealand to Australia, where I help people create better plans for their big move abroad. So if you're moving to New Zealand or Australia and you want to plan better, please make sure to hit like and subscribe. Salamat po! And what do you think about our new studio? You like? Is it cozy? Are you comfy? I hope so. Next! Who can enroll? You can enroll in Medicare if you live in Australia and you are any of these: an Australian citizen, a New Zealand citizen, an Australian permanent resident applying for permanent residency, a temporary resident covered by a ministerial order, and you can also enroll if you're a citizen or permanent resident of any of these: Norfolk Island, Cocos Island, Christmas Island, Lord Howe Island. You may also be able to enroll if you're visiting from a reciprocal healthcare agreement country. So that includes those who are visiting from Belgium, Italy, Netherlands, Norway, Slovenia, United Kingdom, Finland, Malta, New Zealand, Republic of Ireland, and Sweden. The details are available at Medicare website, so please check that out. Next! What you need to enroll. The documents that you need to submit will depend on your situation. So in my experience as a New Zealand citizen, I had to provide documents which proved my identity and residency, and the same goes for my husband and daughter. So that includes our New Zealand passports and 2 documents per family which prove that you live in Australia, dated within the last 6 months. So the documents that they require are either 2 documents from Australia or 1 document from Australia and 1 document from where you last live. And this is the table showing what document you can provide. If you are enjoying this video, then please don't forget to hit like and subscribe and turn on your notification bell so you will know when I upload new videos just like this one. And if you want to support the channel, then click that super thanks icon at the bottom of the video or simply buy me a coffee by clicking the link below. Alternatively, a big thumbs up also goes a long way. Salamat po! How to enroll. Step 1. Complete a Medicare enrollment form. Step 2. Send your form and supporting documents either by post or by email. Now, in my experience, after arriving in Australia, I completed the form and have the supporting documents. I submitted it all through via email. However, I didn't get an automated response saying that my application was received. After a month or so, I did try calling their 0800 number, but it was really difficult to stay in line, at least for me anyway, because it took a long time to get someone on the phone. So I think it was another like 2 months later after I've submitted my initial application. My husband personally went to Centrelink. So Centrelink is like WINS in New Zealand. So he went there, and lo and behold, they haven't actually processed our application because there were some missing documents from my end. But I didn't know that there was missing documents. So yeah, apparently they contacted me through MyGov, which we'll talk about later. So anyway, after my husband visited in person and I provided the supporting documents, we waited for another month before our Medicare application was approved, and it took another 2 to 3 weeks before I got my actual Medicare card in the mail. So all in all, it took about 3 months. So just very quickly, it's not compulsory to create your MyGov account, but it helps if you have one because, like I said, I didn't realize that they were communicating through my MyGov inbox. And I guess the simplest way I can describe it as MyGov is like the center hub of all government services that you will likely encounter. So you can link your Centrelink account. Like I said, Centrelink, if it's New Zealand, I think we have WINS. I think that's the closest comparable service that I can think of. You can also link your ATO. So in New Zealand, that will be your IRD. Same thing with your TMR or NZTA in New Zealand. And then obviously Medicare. More about MyGov on a different video. But first, let me share my friend's story. So my friend is based in Sydney and they applied for their Medicare April this year. However, it also took them a long time to get it processed. So she was trying to call the toll-free number, but same thing, she would be on hold for a long time. She submitted her application via email and then finally she got it processed early July. I think she managed to talk to someone who can actually do the application through a phone call, which I wasn't really sure about the details because if you look at the Medicare website, it will only send the instruction as via email and by post. But like I said, for her, she lodged her application via email first, tried to get an update. I think she did manage to talk to someone from time to time, but it was just taking a while for her application to be processed. And then finally, first week of July, someone helped her with the application via phone call. For your reference, Medicare card have 3 types. Green is for a standard Medicare card, blue is for interim Medicare card, and yellow is for reciprocal healthcare agreement Medicare cards. And some reminders. The standard green cards are available for 5 years. You will be sent a new card before the old one expires. You don't have to do anything else unless your address has changed, and if it has, you'll have to update your details so they can send your card to the right address. Now, for the interim blue cards, they are valid until the expiry date on the card. If you are an applicant for permanent residency and your visa conditions haven't changed, you will be sent a new card before your old one expires. And if you don't get a new card, you'll need to contact Medicare. You don't have to do anything unless your address has changed. If it has, update your details so the card gets to you. If you are a temporary resident covered by ministerial order, your Medicare card is valid until the expiry date. To continue to access Medicare, you'll need to meet certain criteria and re-enroll in Medicare. For those under reciprocal healthcare agreement Medicare card, you will get a yellow Medicare card if you are visiting Australia from a country with RHCA. Yellow cards are valid until the expiry date on the card. To continue to access Medicare, you'll need to meet the RHCA criteria for your country and re-enroll in Medicare. Next! Medicare and tax. So you know how in New Zealand we have ACC levy, in Australia we have Medicare levy. The Medicare levy is an amount you pay in addition to the tax you pay on your taxable income. There are some people who may be eligible for Medicare levy exemption and reduction, but I will not discuss that in this video because this conversation has been long enough. Just know that you may also be asked to pay a Medicare levy surcharge if both you and your spouse and your dependent children do not have an appropriate level of private patient hospital cover you earn above a certain income. This is the Medicare levy surcharge, income thresholds, and rates for 2023 to 2024. Question of the day. What is your first impression of Medicare? Is it a yay, nay? Let me know in the comment section below. For me, because I am enrolled in a bulk billing practice, it's really good that I don't have to pay anything for a GP consultation. So when I was living in New Zealand, even though I am a New Zealand citizen, I still had to pay part of the GP consultation. So because I was enrolled in that GP practice in New Zealand, whenever I have to come in for a consultation, I only pay $45 instead of $90 if I'm not enrolled. So yeah, just point of comparison I thought I should share. Now, for those who are not Australian citizens, Australian permanent residents, New Zealand citizens, or basically if you're not eligible to enroll in Medicare, then you will need to get private health insurance, and this is usually a requirement of your visa application as well. And then for some, even if they are eligible for Medicare, they would still take on private health insurance because of the Medicare levy surcharge, or because they don't really want to rely on the public health system, especially if they have to be on a waiting list for non-urgent surgical procedures. If you think this video is helpful, then share it. Share it to your friends and watch my other video about buying your first car in Australia. As always, I wish you all the best with your journey and I hope you will be blessed. I'll see you soon. Bye!